My name is Jackie C. and I am a clinical dietitian at Mayo Clinic. Patients often ask about cross-contamination and are surprised when I tell them that it is a real concern. Cross-contamination can occur if your food touches something with gluten. Common causes include the field, the factory, restaurants, or even in your own home. What are some examples? Well, in the field, gluten-free grains may be grown in fields adjacent to wheat or barley, or the grains may be shipped to the factory in the same truck or train car as gluten-containing grains. In the factory, they might be stored in the same facility or processed on the same equipment. In restaurants, gluten contamination can occur if your gluten-free hash browns were cooked on the same grill as regular pancakes, or if your steak was cooked on the same grill as breaded meat. Another example would be a deep fat fryer. If your gluten-free fries were fried in the same oil as batter fried foods, they may have been gluten-free going in, but they weren't gluten-free coming out. Another example would be water used to cook regular pasta and then gluten-free pasta. This contamination may not be harmful for people with non-celiac gluten sensitivity, but it could have a big impact on someone with celiac disease. Maybe you're thinking, well, I ate it and didn't get sick. But remember, not everyone with celiac disease has symptoms, and perhaps the amount of gluten was small enough so that you didn't feel symptoms, but large enough so that it could cause damage to your intestine. And if this happens repeatedly, it could have a big impact. Cross-contamination could also be lurking in your home. Do you use the same toaster as family members who are eating regular bread? Do you share a peanut butter jar, mayonnaise jar, butter dish, or jelly jar with people who eat regular bread and double dip? Are you using a colander, strainer, or cutting board that you used before you got celiac disease? All of these could be harboring particles of gluten. So, what can you do to protect yourself against cross-contamination? Read labels. If a product is labeled gluten-free, that means it must contain less than 20 parts per million, including any cross-contamination. Buy grains labeled gluten-free. Oats are not the only grain that can be cross-contaminated. When eating out, identify yourself as someone with celiac disease. That way they will hopefully handle your foods more carefully. Ask how they control for cross-contamination. Do they have a separate grill, a separate fryer? If you're not getting anywhere with the wait staff, talk to the chef or manager. If a gluten-free household is not practical and some family members still eat gluten, set up a system to keep your food safe. Have a separate storage area for your foods and a separate preparation area. Have your own toaster, butter dish, peanut butter jar. Some people like to use a color coding system to make it easier to remember. In closing, cross-contamination is real, but by taking some precautions you can protect yourself from it.